Medical delays extend far beyond the vaccine here in Iowa, and it may have cost a young woman her life. Aaron, it's just heartbreaking, this story. The help this woman desperately needed came 3 months too late.
Exactly, Dan. Brianna Stevens was just 26 years old. She had already accomplished so much in her short life, and she still had many goals she hoped to achieve. Her devastated father explains why she did not get that chance.
She was about 5 years old there.
Craig Stevens talks about his daughter Brianna with affection.
And she would be bouncing around the townhouse doing somersaults and backflips and nonstop, you know. And
admiration.
She was very active, and she was very competitive in sports. She loved to play soccer and basketball. She played the piano. She loved to read.
And pride.
She had a degree from Drake in cellular biology, molecular biology, and biochemistry. She had a master's in bioscience then after that at Iowa State University. She worked part-time as a certified nurse assistant, and she aspired to one day go to medical school.
There is also grief.
She started having issues of both anxiety and depression that over time became more disabling and more challenging to treat.
When did depression start being an issue for her? How young was she when that started?
Yes, I think right around adolescence, age, I think around 13.
As a dad, how hard was it to see her struggle?
Extremely hard. And yes, the depression, it really took hold, and anxiety, so that her functioning was sometimes could be very difficult.
It got so bad, Brianna tried to kill herself multiple times.
In February, she had a suicide attempt and was stabilized in the hospital and discharged. And the psychiatrist looked at the whole situation and realized she was maxed out on meds.
He recommended adding a different treatment. It was denied.
She said, "This insurance company is going to kill me," you know. She was just ready to just give up.
And 11 days after the denial, Brianna did give up. She died of an overdose on March 29th.
Yeah, I mean, that Friday she's sitting here taking a nap, sitting here talking to me, and we're praying together and talking, and Monday she's gone, you know. Yeah, I mean, it just really blew me away. I didn't have any words. I mean, I just said, no, I can't believe this.
Stevens isn't just a grieving father. He's also a retired doctor.
To me, it's not surprising, because I know when I practiced, we would have these wrestling matches with the MCOs, and we would have to go through multiple appeals.
MCOs are managed care organizations, insurance companies that manage Iowa's Medicaid program.
What does it take for these people? They're supposed to be providing medical care for the Iowans in need. In her time of need, they denied her.
As her father and executor of her estate, Dr. Stevens wrote to Amerigroup asking questions about Brianna's case. In a letter dated November 1st, Amerigroup's planned president responded, explaining that the prior authorization was denied because the drug was not a covered benefit under the Iowa Medicaid program, as it was not on the state's preferred drug list. It goes on to state that as an MCO, Amerigroup is contractually bound to follow coverage rules set by the Iowa Department of Human Services.
They weren't keeping up with the community standards. Other insurers in the community were offering this treatment, and it was widely available, but Amerigroup did not offer this treatment. It had no official billing code. Amazingly, after Brianna passed on March 29th, they managed to have an official billing code in place, and it works now as of July 1st.
What would you say to people who hear Medicaid and they think, well, that doesn't affect me?
People should be concerned, because their tax money goes to subsidize or pay for this system. They should have an interest in where that money goes.
You've contacted state legislators, our federal representatives. Talk about that process and what you've experienced.
So I've sent out about 20 letters, DHS And our state officials, our state senators and state representatives have been ignored. I haven't had any response.
Dr. Stevens isn't the only person looking for answers.
There's a person involved here. Right. When I was a criminal prosecutor, their liberty was on the line, but these are people who have their health care on the line.
State Auditor Rob Sand recently released the findings of an investigation that he says shows a massive increase in illegal denials of care by MCOs.
In the last 3 years of publicly run Medicaid to then the first 3 years of privately run, the number of times that independent judges overturned denials of care, meaning they said this was wrong to deny this care, we're going to give this person their health care back, increased 891%.
Iowa Medicaid Director Elizabeth Matney calls the report incorrect.
The way in which the auditor structured this analysis is deeply flawed. The comparison groups simply are not the same. The math just doesn't add up.
Sand acknowledges that the total number of appeals has gone down under the privatized system, but says it's the incredible increase in the number of denials that judges are overturning that most concerns him.
This program was brought in with the promise that it was going to improve access to care and quality of care.
Matney says it has.
What Auditor Sand didn't acknowledge in his analysis is that these samples are not comparable at all. There's a first level appeal process now through managed care in which a lot of those easier cases are cleared off the deck, things are resolved.
And she used to do all these flips and little gymnastic stuff. And
the initial shock of his daughter's death has worn off for Dr. Stevens, but the devastating sense of loss has not.
There were many, many, many happy times with her. It wasn't all just depression. We just try to focus on all the good times, because nothing we can do can bring her back.
He's keeping her memory alive by sharing her story and hoping it makes a difference.
It's pretty much been a wall of silence, but I'm not going away. And if I can use this to try to help someone else to not undergo this, I will.
Though Dr. Stevens did not hear back from any of the state lawmakers he says he wrote to, I did, and I received an email from a DHS spokesperson that outlines the process by which a drug is approved. So it's the timeline that you're looking at here, and it is specific to the drug Brianna's psychiatrist prescribed. It's called Spravato. So you can see initial guidelines for it were adopted back in February of 2019. Then the very next month, March, initial approval was given by the FDA for one of the diagnoses that Brianna had. Then by August, for another diagnosis, it was approved for acute suicidal ideation. Again, something Brianna suffered from. So here's where it gets interesting. It took until 2021, this year, for this drug to be included in CMS's, that's the Centers for Medicaid Services, 2021 code updates, for it to be included there. And then it was another few months into April of this year that it was approved locally by the Iowa Clinical Advisory Committee. So quite a process for a drug to make it onto that preferred drug list.
Process or lag time, depending on how you'd want to describe
Yes.
it, Aaron. Now, Dr. Stevens, he didn't hear back from any state lawmakers. He did hear from some of the people he reached out to, though, you said.
Yes, his letter and all of the responses he received will be on our website, WHO13.com.
I know we haven't heard the last of this. Thank you, Aaron.